My government is opening the first Syndemic center in the country at the Embu Teaching and Referral Hospital that will set pace to manage syndemic diseases, that is HIV and AIDS, tuberculosis, and the one loaf. This is critical to the attainment of the well-being of all the people. The government aims to allocate more funds towards HIV and AIDS prevention and control activities. Our vision is to have a county free of HIV infections, stigma, and AIDS-related deaths. We intend to achieve this through provision of comprehensive HIV prevention, treatment, and care. The number of new HIV infections among children aged 0 to 14, although on a decline, is still high, accounting to 36 new HIV infections. The HIV crisis among children and adolescents aged 15 to 19 years is exacerbated by a worrying trend. In 2021, 1 in every 2 cases of sexual and gender-based violence cases reported occurred among adolescents aged between 10 to 17 years. In the same year, 16%, that is 2,416, of all reported pregnancies were among adolescents aged 10 to 19. This disrupts the continuation of education for girls and poses significant micro and macro level challenges for socioeconomic development. I call upon all stakeholders to join hands and support the national and the county government in its endeavor in the fight against HIV and AIDS and teenage pregnancies and stop gender and sexual-based violence.
0 to 14 years, every year we are getting 36 cases, close to 40. 14 to 19 cases, 14 to 19 years, we are getting close to 50 cases per year, new HIV infections. Should we have those cases? Should we have? Na ndiposa nime-acknowledge madaktari kwamba we should end new HIV infections. Wacha tubaki na ile daktari ametuambia hapa, the already positive cases, the 11,000 in Embu. Embu tuko around 610. So if we are able to stop at that, and we treat these ones waendelee kupewa ARVs, then we protect the 600 remaining from getting to the 11,000. I think we'll be good to move, and the health sector indicators will be better because we will continue preventing more new cases, and once we prevent, then economic status iko juu. If we end new HIV infections, even the cost of treatment alone, it will have gone down for Embu and for Kenya, because the treatment is free, and of course it is free because kuna mtu amegharamia hiyo. So if we don't have this number of the positive cases, the cost of treatment goes down. Ningeomba kila mtu mwenye wako hapa apate kuchangia kuzuia new infections na kuzuia wasichana wetu wasipate mimba. Wacha tufiche watoto shule for the purpose of continued education. Ni kwa sababu one of us ametuambia vizuri sana hapa, ukipata mtoto at 13 years, hiyo masomo itasomeka kweli? Haitasomeka. So tungeomba tufiche watoto wetu shule, waendelee na masomo, waendelee kusikiza mashauri kwamba wanashauriwa kwamba teenage pregnancies is a danger.